This is a simple movement that can offer you some relief when you're experiencing acute low back pain. Come to lay down on your mat, or you may be laying down in your bed. If you can, have your feet flat to the floor and your knees bent. You don't have to have your heels tucked really close in towards your pelvis. Start to connect to your breath. By that I mean pay attention to how you're breathing. And this often helps to just down-regulate you if you're particularly feeling quite uptight about any pain you're experiencing. See if you can notice on your exhale, you can feel a little bit of drawing in and gathering through the muscle tissue in your abdominals. And then on your next exhale, so you breathe in and out, lift one knee in towards you. I'm going to hold on to the shin and gently then pull the thigh in towards your body. Now this might not be possible. I'm working towards my full range. You might not pull the leg in so far, but know that you can be at any point here, and you will start to hopefully feel your lower back pull in towards the floor or your bed. So you move as much as you can without causing any sharpness or shooting pain. Gently pull that knee in, and as you breathe out, lower the foot back down. The reason we move on the exhale is that often we engage on that exhale the deep abdominals. They kind of have a little bit of a squeeze, and that it can give you a sense of feeling supported through the lower back. So breath in, a breath out, and you'll lift your opposite knee in towards you. Support that with your hands, and I'm gently going to pull the shin, pulling the thigh towards my rib cage, and as I'm doing that I can feel the pelvis slightly tip backwards and my lower back flatten down towards the floor. And this is where we get just a very gentle mobilizing between the vertebral joints, the little spaces in your spine where you have the discs, the vertebral discs. Lower that foot down, and we'll do that again. One knee in on an exhale if you can. You don't have to be too precious about that. The important thing is, if you are suffering from or experiencing radicular pain, which is our sciatic pain, getting some movement may help to relieve any muscle spasm you're having. Opposite leg drawing in and lowering down. If you feel this is working quite well for you and you feel supported, if you bring one leg in towards your rib cage, you might find you can just bring the other leg in, holding the knees and the feet together and supporting your legs with your hands, and maybe even taking a very small gentle rock from left to right. It's almost as though you're rolling the lower back into where you're laying. A little twist from side to side through the back of the pelvis. You only need to do that for a few seconds, and with control. And again, if you feel more supported by moving on an exhale, which often you do, breath in, breath out to lower one foot, breath in, and a breath out to lower the other.